Hello, we are live once again. Welcome back or welcome to Lisa Moss Medicare. I put this channel together for you for Medicare education. So you understand the basics, the nuances, the development of Medicare and how to navigate this system, which can be very confusing at times. So I do my best to give you the basics of the confusion so you know how to navigate yourself and you have the education, because remember, you're the consumer. You worked all these years for this. This is your health care. Now, I don't work for the federal government. I don't work for the Department of Medicare. I am a licensed insurance agent and broker. What that means is I'm licensed with all the different companies. So I'm able to look at the whole landscape. It's as if you went to go get a house loan. If you just went to one bank, you'd only get their loans. However, if you go to a broker that brokers out all the loans, you'll get all the different company loans. And that's what I do within the Medicare system. Now, we do have, I'm going to show you first my information. If you want to get in touch with me, I'm located in Southern Idaho. I'm licensed in several states. If I'm not licensed in your state, I will be more than happy to find a good agent that is. But just for basic information or questions, you can always call me direct at the 208-544-5011, or you can email me through the website of insuranceover65.com. Also on the website, there's a lot of articles. If you don't feel like watching Facebook, just go to the Facebook Live and it'll download all the information on my channel, Lisa Moss Medicare, of all the videos I've done. But if you want to read the information or get more information, go to the website. It has articles that I've written over the past year on the website for you. So that's how you get in touch with me. Also today, you can write comments if you want to in the comment section, and I'm happy to. That's what these live sessions are for, to answer any of your questions live each week, coming to you from YouTube. We're no longer using Facebook, just YouTube. Okay, let's get going. So today, what we're going to talk about is the Medicare basics. Just the basic information. Most people do not know the basic information. I went and did a talk at one of the hospitals locally here in Southern Idaho. The doctors came in and they had no idea about Medicare and the nuances and just the basic information. So I think it's really important. Let's start at the beginning. When you first get Medicare. Okay, so you're starting to turn 65. There is a window. It's 3 months before your birthday month and 3 months after. I always suggest starting 3 months before. Social Security is really backed up right now, and it takes a while to get into their system. So when you first sign up for Medicare, you're going to sign up for A and B, or just A, just B. We'll go through that. So if you're going to stop working at 65, then sign up for A and B. A is your hospitalization, B is your doctors. Now, A is free, B, there is a cost. It's $174.70 this year of 2024. It goes up about $10 approximately every year. So there is a cost for Part B. A and B cover 80%. So you want your very first step is to sign up for those. There's 4 ways actually you can do it. First way is you call Medicare directly. I don't suggest that. You're probably going to be sitting on hold for quite a long time, and it's going to take a while. They're very backed up. I wouldn't call them. That would be my last way to do it. The second way is you can go down to your local Social Security office. Sometimes you need an appointment, sometimes you don't. Go into the office and find out. Ours is pretty easy. You usually can get in and you sign up for your A and B. The third way is you can do it online. This is the easiest way to do it. ssa.gov and sign up for Medicare. You're going to have an account. You sign up for that first. Make sure you have your computer or your cell phone with you, an email address. They're going to send you some notifications and some codes that you're going to need to put in. So make sure you have all of that set up beforehand, that you make sure you have your tools, basically. SSA.gov. The fourth way is you can call me, or you can call a local representative that can help you sign up. I always suggest either sign up online, SSA.gov, or call me, 208-544-5011. I'm happy to help you. So you're quitting your work and you sign up, say your birthday's in March, you would sign up in December to start March 1st. Okay, A and B. So you wouldn't have the 174.70 till the beginning of March. That takes care of 80%. We'll talk about the other 20% in a minute. Now, if you're going to continue to work, that's a different animal. If you're going to continue to work and there's less than 20 employees in your company, sign up for A and B in your supplemental. Go ahead and just do that, because your insurance with your company is going to become secondary. So you don't want that 20% cost structure. That's a whole different animal. Call me if you're going to continue to work and you have less than 20 employees. Most people that continue to work are with fairly large companies. So there's more than 20 employees or more. If you're going to continue to work and you're in a big company, or more than 20 employees, it could be a small company, then just sign up for A. A doesn't cost you anything. Continue with your health care. Now, if you're with a company and your healthcare is super expensive, then you've got to weigh it out. Is it better to sign up for Medicare now, or is it better to wait and continue on with your healthcare? If you're going to continue to work and you sign up just for A, about 2 months before you end your job, before you're going to leave your work, then you sign up for B. That's another call, Lisa. Call. Just to make sure that you don't have there's penalties if you don't get it right. So make sure you get it right. Okay, so that's the first step, signing up for A and B, or just A, depending on your situation. Once you do that, it takes about 6 weeks for the Social Security office to get you your card. It's going to be a red, white, and blue card. It's going to have your Medicare number, which is like 6VF4883. I mean, they're just a mix of letters and numbers. It's impossible to remember that. They used to use your Social Security number, but now they don't do that anymore. They give you this odd number. You're going to get that number and your A and B start date. Once you have those three things and that card, you can call them and get the number if you haven't got your card yet. Again, they're a little behind this year. Then you can sign up and deal with that 20%. There's two ways to do it. You can do a Medigap or supplement policy that covers your 20% and your standalone drug plan. Those Medigap policies are letters like G or N, or there's high deductible ones. You want to sit down with somebody and go through your choices if that's the way you want to go. The best one right now is either the Energy. They run between 150 and 200, 250 a month, depending on your region. It's all dependent on state and on county. And then sign up for a standalone drug plan, even if you're not taking drugs. In our region, if you're not taking drugs, there's a drug plan that's 50 cents a month. That's what you want. It doesn't matter the cost structure so much. It matters what drugs you're on. So you want to check in and make sure you put your drugs in your drug plan and find the best plan for you. Anything with a drug plan goes from January 1st to December 31st. Okay, so make sure that you do sign up for a drug plan and a gap plan. If you don't want to pay the money per month, you're already paying $174 per month anyway for your Part B, you can do a Medicare Advantage. Right now, your Medicare Advantage, there's policies that cost $0 per month. So you don't pay per month like you do with the supplementals. You pay as you go. You'll have some co-payments, some co-insurances. So you pay along the way. Also with Medicare Advantage, you're going to get some extras, some dental, some vision, some hearing, some over-the-counter benefits, some gym memberships. Those could change for 2025. We're going to see a lot of changes. We won't know till October what those changes are, but I guarantee you we're going to see some. So And they include your drug plan with a Medicare Advantage policy. So again, whether you have a standalone drug policy with a supplemental or a Medicare Advantage policy, those drug plans go from January 1st to December 31st. You have a window to change October 15th through December 7th. That's the window you always want to check in with your agent, always. If you don't know who your agent is, and the statistics show 80% of the people don't know their agent, seems a bit high, but I'm running into a lot of people that don't know who signed them up and don't know who to call. Feel free to call me. I am happy to help you. I'll have a spreadsheet in October that will tell you each of the different companies in our area of what those changes are. So those are your two choices. You want to sign up for one of those because you don't want to pay that 20%. If you break your arm and you go into the hospital and you have a supplemental, you're going to probably have a $240 deductible with a G plan, and they pay for the rest. But you're paying per month. You're paying about $400 a month with your Part B, your supplemental cost, and your drug plan cost. Medicare Advantage, you're generally only paying about $174 for your Part B, but you will pay as you go. You might have, say, an $1,100 bill approximately for an arm break in the hospital. I don't know. It just depends on your hospital and your area, but you're not paying that per month, so you can save that money. So those are the basics of Medicare. However, there's a lot of nuances. When you can change supplementals, you can change any month, but you may go to underwriting. If you're on a supplemental and you want to change over to Medicare Advantage, it's very easy. If you want to go back to supplemental, it can be very difficult. If you move counties, you definitely want to check in because you're going to have to change your plan. Even here, if you're in Twin County versus Jerome County, there's different plans. Then there's low-income subsidies. If you make under about $1,200 a month, apply for Medicaid. There's Medicare, Medicaid policies that work together. They're called dual policies. They give you a lot more coverage, and they cover a lot more things. They'll pay for your Part B. They'll pay for your drugs. They may even give you some food supplements and over-the-counter supplement benefits. If you don't qualify for that and you make about 50 grand a year, what's that, about $1,900 a month, then you can apply by your state for a low-income subsidy at the same website, ssa.gov. And they will pay for your Part B. If you can get the low-income subsidy, you also can get on a partial dual plan. If you're diabetic, if you have heart conditions, if you have major conditions, you can also sign up for a special needs plan that covers those, or a dual plan that covers those. So those are all the nuances that it's really important to check in with somebody. Do not try to do this yourself. Do not attempt it at all, because we're free. We don't cost you anything. We get paid by Medicare. We get paid by the companies. We come as a service to you, and we're the experts. We're supposed to be the experts. Those agents that don't check in with you, or you don't know who they are, then there's somebody out there that's supposed to help you that there's no cost for. Call me. I'm happy to help you. So those are the basics of Medicare. If you have any questions or you need to reach me, you've got my number. And I also want to say happy 4th of July. It's coming up next week. We'll be back next week as well. The next 2 Fridays, we will be here, and they're always recorded for you on Facebook under Lisa Moss Medicare. Have a great weekend. Bye for now.